of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Good afternoon.
Hi, thanks for having me.
Welcome back. We had a viewer wrote to me this morning and said, when Dr. Keteyian is on, remind the audience that we're still in the pandemic.
We're still in a pandemic.
There we go.
Yeah,
still in the pandemic.
Still here.
So let's take a look at, we're beautiful weather this week. It's going to be in the 80s. What's COVID going to look like this summer?
It's hard to say. It's hard to say. I think people have gotten to this predicting game in the past, and most of us are wrong. I've seen different predictions. There's a group that does them out of University of Washington. There's another group that does them at Hopkins. And what typically has been happening is that in southern states, we see more of a surge happen in the summer. It's hot, people are indoors, and so we see transmission happen there. And then we see a larger surge happen in the fall when people come back inside across the country. And I think that's probably likely to be the case again. How big it is, we don't know yet. But we do know that the immunity, whether it's from the vaccine or from natural infection, really just doesn't, it doesn't last, right? So we would expect that midsummer, fall, our biggest surge we've had so far with Omicron was just in December, January. So by summer, people that had it are going to be no longer immune. And so I think we're going to have a lot of susceptible folks, and then the opportunity to see a big surge again.
Seems like the message, particularly from the CDC, is, well, we're really concerned right now with hospitalizations. That's what we're going to focus on. We want to keep hospitalizations down. And it seems like every other measure in terms of reducing spread is kind of back burner.
Yeah, and I don't think that's wrong. I think we want to prevent people from getting very sick and dying. I think that is definitely a good endpoint to try to avoid. And it's so, the virus now that's circulating, the BA.2, which there are subvariants of that, is so contagious. It's really hard to prevent the spread. And without public health measures, wearing a mask is really the only way, or just not being around people is the only way you're really going to prevent spread really successfully. The vaccines still certainly work, but they don't have the same level of effectiveness. This isn't 90-95% effectiveness like you had in the beginning with the earlier letters in the Greek alphabet, right? So I think that's why the CDC partly is saying we need to protect people from getting really sick. And in general, we've seen that. Even as we've seen cases tick up across the country now with Omicron, hospitalizations have remained relatively stable, which is good. Here in Jackson, we're still seeing 10 to 20 hospitalized folks at any given time, which isn't insignificant. That's not something we'd ever had before. So now on top of our regular volume, we just have an extra 10 or 20 people always in the hospital with COVID. And you can look, the numbers are on the county website for Jackson County. Up until March, we were still losing somebody every day. And even in April and May, it's a handful of people every week that don't survive. Just this last week, we had 3 people die. So Jackson's not that big of a community. And so I think losing, that number of people every week is pretty significant.
Yeah, 500 people over the course of the pandemic in Jackson County.
Yeah, and we're up to almost 600 now. I think it's 570 or something like that. So we just keep going up a few people every week. Yeah.
So these 10 to 20 or so that are hospitalized with COVID, are they coming in for something else and they're being tested and showing that they are positive for COVID, or are they coming in because COVID has made them so ill? It's
usually that.
Really?
Yeah, these are usually people, and I've heard people ask that, or these people that have, heart failure and they come and they get tested and they're COVID positive or something else. But these are usually people that are coming in because they're short of breath or something else, and they're being hospitalized for their COVID. And the preponderance are unvaccinated. It's 80+% of these people are unvaccinated, completely unvaccinated, didn't have any vaccine at all. So those people are in that's a very sort of vulnerable position to be in. So I think we'll continue to see that until we get those rates up. The other thing that's actually really important And this is a very important message, is that people who, so as soon as you have any symptoms that could be COVID, you should get tested. You should get a test. Doesn't matter if you get a PCR. If you come to us and get a PCR test, great. If you go somewhere else and just get a rapid test, great. If you have a home test, take whatever it is, test. If you think it's allergies or something else, get a test. That's the only way you can know if it's COVID. And then based on that, there are treatments, right? So there's a pill called Paxlovid, and we still have monoclonal antibodies. The Paxlovid you can be given within 5 days of symptom onset, and the antibodies within 7. So you have to get it soon. You can't say, well, I've had it for a week, I'm not getting better, let me go get tested now. It's too late. Then you're beyond the medication. And there are still people that get worse at that point and end up hospitalized. So really the trick with this is, as soon as you have the symptoms, get the test, know what you have, so you can call your doctor and get a hold of one of the therapies. And to get one of the treatments, you have to be in a, quote, high-risk group. But the majority of adults now actually fall into a high-risk group. So a BMI over 25, which makes somebody overweight, puts somebody in the high-risk group. And 70% of adults in Jackson are in that category. So over 65, diabetes, heart conditions. I mean, so there's the traditional things people think about of like, these are, more frail people. But even a BMI over 25, which is basically 2/3 of us, qualify, right? So, and that puts you at higher risk. So get the test, call your doctor so you can get treated.
And I think the hesitation has been, and I think someone that suddenly has a cough or stuffy nose or any one of the symptoms that could be COVID, could be something else, they don't want to know. They don't want to know because then they are afraid they are spreading it. They're afraid they're going to have to do the isolation, the quarantine, the contact tracing. It's just, it becomes, it's a lot.
Yeah, I do think there is that attitude out there that I'd rather not know, but then you're obviously putting other people at risk. So the quarantine and isolation guidance now is pretty, it's pretty weak. I mean, we're telling people if they have COVID, they basically have to stay home for 5 days. I mean, you're going to feel sick anyway. Like, you're probably going to want to stay home for 5 days. So we're not really disrupting people's lives in the way that we did, 2 years ago. So I don't think it's a lot to ask if somebody is having those symptoms to figure it out and then figure out a way to isolate themselves for others for, the better part of a week.
Have the symptoms changed? Because I was surprised personally last week. I developed a cough. And so I looked up the symptoms, and suddenly cough is the #1 COVID symptom. And I thought, doesn't seem like that was the top of the list.
So fever, cough, shortness of breath have always been kind of the triad folks have talked about. But it's really not something you can differentiate based on symptoms. And this is a conversation I've had with other doctors, right? We've sort of talked about this is, if somebody comes in with a fever only, or they just have malaise or body aches, do you need to test somebody with that, or is it the flu, or is it something else? And you really can't tell. Like, you really can't tell based on symptoms if it's COVID or something else. The one symptom that's very, very specific to COVID is the loss of smell. Really nothing else causes that. It is this common. I mean, that's a really specific thing to COVID. But everything else, the headache, the aches, the fevers, the chills, the cough, whatever, you have to get a test. There's just no other way to really know if it is or not.
And of course, it's allergy season, so people have all of those symptoms.
People have a runny nose all the time, and it was funny because they still have people in January telling me it was their allergies, and I'm like, it's not your allergies. Let's go we got to get a test. We have to know what this is. It is common for people. I just think they need to be aware. And the tests are so cheap. They're so easy to get a hold of now. It's not a big deal, and it's better to know and then be able to get treated because of the risk factors people have. And there's this assumption that we have this now and it's getting less severe and I'm not going to get that sick, but that hasn't been the case. We're definitely seeing people still get very ill and end up in the hospital. So we have to be aware. We have to still be vigilant about it.
So now most of the U.S. population has some sort of immunity from being sick or from getting the vaccine and boosters. At what point do we have enough people, the so-called herd immunity, that this disease just goes away, or will it ever?
No, that's a really good question, and that's something that I think has been debated in a lot of places too. Anthony Fauci has even said that herd immunity probably isn't attainable now, and I would tend to agree with that. I think that the way we think about herd immunity, with more traditional viruses, things like the measles or polio, things like that, those viruses are much more stable. They don't change as much as this coronavirus does, and so to get herd immunity to something that is so unstable and changes so rapidly, I think is going to be really, really difficult to do, because immunity just can't be long lasting. We end up with a virus that doesn't look the same enough over the course of 6 months to a year, and then we're kind of back where we were, which is kind of like the flu, right? I mean, that's what happens with the flu. We get a flu shot, we do the best we can to protect people with a flu shot every year, but ultimately the flu strains that circulate the next season are different, and so getting herd immunity it's just really not possible.
The number of people with COVID now, particularly because they aren't getting tested or they're just doing the home tests, it's an undercount. And now the CDC and the World Health Organization are both saying it's likely the number of deaths, both in the United States but worldwide, is seriously undercounted.
Yeah.
I think we're at 6 million officially from countries reporting. WHO says, it's probably more like 15 million.
Yeah, I've heard anywhere from 15 to 20 million globally. In the US, if we haven't already gotten there, we're very close to 1 million actually documented. I mean, so in this country, we're actually probably better than most countries good at documenting COVID-related, deaths, because those are happening in a kind of a structured environment where you can do the testing. But we're very close to 1 million deaths here, which is really staggering. In terms of excess deaths for a year 2 years in this country, that's quite substantial. So that's not an exciting milestone.
It's amazing. I can't imagine what we would have all thought as a population if in March of 2020 it was announced that this is likely going to claim 1 million lives. Yeah. We just wouldn't have. I don't know what we would have done, but
I think we've all been wrong. I think any of us who predicted what the waves would look like, and how severe it was going to be, and herd immunity, and I think we've been wrong a lot about this. It's been much more difficult to manage than any of us really expected at the beginning. The good thing is we have so many tools now we didn't have before. I remember, this is 2 years ago now. When this first started, we had nothing. We had literally nothing. We had no vaccines, we had no medications, we had no antibodies. It was very scary, because if you got it, it was roll the dice. Now we have a lot more tools that we can use. We have the testing, we have the treatments, but even still, you can't use those unless you have it, right? Yeah. So people need to avail themselves of the tools we have now, because we're in a very different place now than we were 2 years ago.
Yeah, I remember the early weeks. You came into the hospital, all you could do is put them on a ventilator at the worst. That
was pretty much it. Put them on oxygen. We used what's called prone positioning, so you lay someone on their stomach. There was some data that showed that worked. Steroids seemed to help maybe. So we just really didn't have a lot. It was really hard, for the docs in the hospital that time, because you're just like, you're trying to help, but you don't have anything. It's very difficult. It's all supportive, and hopefully people will just kind of pull themselves out of it.
We also have, significant staffing shortages because of the pandemic. I know that Henry Ford is bringing in a cohort of nurses from the Philippines, and they're, I think, going to be arriving as early as this summer.
I think that's right. Yeah, I think it'll be this summer. Staffing has been a creative challenge to solve, or a challenge to solve creatively, and it's affected every spectrum of the healthcare environment, right? Providers, there's physicians that have said, I'm tired, right? I'm good now. I'm going to retire or whatever. Same thing with nurses. I think we saw a lot of people that were kind of close to that window that ended up leaving a little bit early. And I think we had people that were more mid-career that pivoted and did other things. This was a very challenging 2 years for people in the provider space, not just doctors and nurses, but there's nursing assistants and there's phlebotomists and everybody, sonographers. There's so many people that work in a hospital, work in clinic settings, and it was hard on everybody.
And it still is.
It still is. It still is.
So the people that have not had COVID, are they possessing some sort of special immunity? Are they going to be safe?
What's interesting about that is there's actually studies that are happening to people that haven't had COVID to see if they have like some sort of special immunity or some property that's kept them from getting COVID. It's so easy to transmit. And there's one study they're actually looking at people who are in the same house as others who've had COVID but haven't gotten it. So there's something genetically in these people that's like kept them immune. I don't know, but I think it's interesting. It's interesting to see if that's the case.
It could be just luck.
It could be just luck. Yeah, it could be luck. It could be that those people have been better about certain behaviors. I mean, I haven't gotten COVID, but I also I'm careful about if I travel. The government doesn't require an N95 mask on, or doesn't require a mask on a plane anymore. I have eye protection and an N95 on. Like, I just do that, right? And that helps me be more safe. I'm careful about where I go and eat out. I'm careful about going to public events. So I think there's things we can do to mitigate the risk. So, I guess I think it's more than luck. I think that, we can choose.
Yeah. So, and I hear so many people say that keep wearing the mask. If you, particularly speaking to somebody who's never had COVID, it's likely that the protection measures you've followed, the mask, the washing the hands, the social distancing, that's one of the reasons. Keep doing it. I
see patients in clinic every day, and so I see a lot of people, right? I'm exposed to a lot of people, and absolutely there's people that I've seen throughout the period of time that had COVID and didn't know it. I've seen COVID patients, right? But the whole time I've had a mask and eye protection and haven't had it, right? And we've had nurses and doctors that work in the ICU, right? And they wear masks and eye protection and gowns and gloves and things they need to wear, but that haven't had it either, right? So the PPE does work. It does actually work very effectively if it's worn like it's supposed to be.
Do you think there are a lot of people that did have COVID that it wasn't severe enough that they didn't even think they had it?
Absolutely. Yeah, absolutely. And even more so now because in the Omicron variant, a lot of folks are getting just more kind of more mild symptoms, and so they'll think it's allergies or something else and don't necessarily get a test. And I think the last estimate I saw, something like 2/3 of the U.S. population, the estimate has had COVID.
Wow.
I know there are studies going on where they're doing like antibody studies to see if folks have the antibodies, and it'll be interesting to see how those come back. But it's definitely a majority at this point.
So still worry about it, still think about it. It's still here.
Yeah, I feel I'm like Dr. Doom or something. I'm like, come on, I have to tell people that, we're still in a pandemic. But I think it's learning to live with it in ways that we can still be safe. And we have tools now that we didn't have before. So we got to use them. We got to use the testing. We got to use the medications and the antibodies and the vaccines. They work. We got to use them.
Well, I think it's the opposite of Dr. Doom, Courtland. I think you're giving people information that's going to keep them out of the hospital, that's going to keep them healthy, that's going to keep them alive. I welcome that, and I welcome the messaging, and I welcome the information, and I welcome the attitude.
Well, I'm glad to hear that. I hope people find it helpful because, this is how you stay safe. We say that to each other all the time, right? Stay safe. Like this is how to do it.
Well, we appreciate all the time you give us and our viewers, and thanks for coming in today.
Yeah, my pleasure.
Vice President of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian.